what is behavioral medicine?
So much in psychology or counseling or being a therapist, it's about, mental health, right? It's about, symptoms of depression or anxiety,
Mhm.
and nothing wrong with that at all. But in the field of behavioral medicine, sometimes called health psychology, there's a little bit more of a focus on the whole person, including um, physical symptoms, physical conditions, stress
Mm.
related things that can be impacted, influenced by the person's mindset, by their ability
Mm.
to relax their body or to turn toward, as we do in mindfulness. And
Yeah.
so much of psychology often, like, unless you want to have the training in how to be with the body and to use the resources of the body, it might not come up so much in regular old psychology or clinical
Yeah.
psychology. And so behavioral medicine is really focused on humans as whole people, perhaps where their behavior can have a very large impact on either their symptoms or their quality of life.
Yeah.
Does that help?
It's so helpful because as you're explaining it, there's an active part that we can each take in our well-being. And behavioral medicine seems to support us in that. Like, we're not just passive recipients of medicine, but what can we do in our behavior to support our own well-being? And that, sometimes it's very empowering as you're sharing it. Like, oh, there's things where I can do to help
That's
myself, right?
Yeah. So when you said that, what struck me is you said behavior or medicine. The way you said it, I was like, our behavior is medicine. It can be.
Yeah. Yes, that's true. So creating change through behavior changes.
Yeah, and behavior doesn't have to be like I'm taking a walk. It could be. It can also be considering my habit patterns of thinking
Yeah.
and making a decision and practicing letting go that. So behavior doesn't only have to be physical things we do. It can be our
Mm,
thoughts, our
yeah.
reactions. Yeah,
So behavior can also involve patterns of thinking, like how we get stuck in thinking.
yeah,
Yeah, yeah, yeah.
absolutely.
You mentioned as well mindfulness. And so here's this intersection of behavior medicine and mindfulness. How do you explain mindfulness for those who are new to it? And then we'll bring it together in terms of mindfulness, behavior medicine, and
In terms of studies in the field of behavioral medicine, we have
yeah.
often used a intervention or treatment called cognitive behavioral therapy.
Yeah,
You might
CBT.
have heard about it. I'm sure you,
Yeah.
and maybe some of your audience does as well. But it's kind of a set of ways of being with our client or patient and helping them to notice what they're thinking and maybe even prescribing things like helpful activities, etc. So that
Yeah.
it's a little bit kind of on the prescribed side. Like there's a better way to think about something than this negative way. And so that would be one way that I would characterize some of what we would typically do as behavioral medicine psychologists that are
Right.
doing research. Okay, that's cognitive behavioral therapy. And
CBT. So
and I was doing that.
challenging thoughts.
Yeah, so challenging thoughts or learning how to do what we call progressive muscle relaxation, learning how to let the muscles
Mm.
go, etc. And so I had a training and all that stuff. When
Mm.
I learned about mindfulness, it that stuff still is still in me, but mindfulness to me is so much broader and
Mm.
it's so much less prescriptive. It's like it's so much more giving, inviting each person to notice what's actually here.
Mm.
So for me, when I learned about mindfulness, I was like, yeah, cognitive behavioral therapy, that's great, but I don't want to do that anymore because mindfulness is about, as we learn to pay attention in this present moment and as best we can just be with what is here, and
Mm.
that can go for anything. When we experience that and we practice it, so much of the have to do this different, have to change your thought, have to da da
Uh,
da, it falls away.
yeah.
And there's almost like in my experience anyway, there's this upwelling of like, hey, it's okay. It's okay that sometimes the judge is yapping at you. Yeah.
Mhm.
And it's less about changing your thinking and more about like opening up to being fully human, if that makes any sense.
Mm. I love how even you use your hand. There's like a bubbling up. You did this hand moving up, palms up, like a bubbling up welling up of a new way of being,
Mm.
rather than this like I gotta fix me, right? Like so that's what I'm hearing from. It's like I don't fix. It's not about I gotta fix it. I'm broken here. I'm broken there. It's being of ourselves, being of our thoughts, being with our emotions.
Thank you. Thank you. And I
Mhm.
appreciate what you say about it's not about fixing. And because it's
Mhm.
like there really is nothing wrong.
Hello there, and thank you so much for stopping by this channel. I hope you find this content useful, and if you do, feel free to hit that subscribe button. It will really help me to reach to more people and keep this content going. Here we are journeying together, and let's see where this takes us.